disturbing practice in the pharmaceutical world. It's a rule that forbids your pharmacist from telling you how you could save money on your medication. When you pay for a prescription, you might be like Michael Dugan.
Always use my insurance.
But these 3 words, pharmacist gag rule, might have you paying cash instead.
I've never heard of this gag rule.
Most consumers haven't, so here's what you need to know. The gag rule is a clause written into contracts between pharmacists and pharmacy benefit managers, or PBMs.
These people are outsourced by the insurance company to handle their prescription programs.
The gag rule forbids pharmacists from telling customers they could save money by paying out of pocket instead of using their insurance.
This is really frustrating.
Mel Brodsky leads an association for local pharmacists.
It's not fair to the consumer, it's not fair to the manufacturers, it's not fair to anybody.
Brodsky says PBMs enacted the gag rule out of greed because they pocket the difference between the insurance copay and the cash price. He also says PBMs drive up the cost of medication overall.
Their CEOs make between $15 and $20 million a year. There's a lot of money that the middlemen are taking.
PBM Association claims it supports patients paying the lowest price and opposes the gag rule. But many states are making pharmacist gag rules illegal. In 2 years, at least 21 states have passed laws prohibiting the clauses.
That's really disturbing practice.
Senator Sharif Street has co-sponsored legislation to ban pharmacist gag rules in Pennsylvania. And President Trump says his new federal plan would do the same. Meantime, there are a couple simple things you can do to get around the clauses.
They can go online, they can check a drug price and see what it's going to be at the pharmacy in their location.
You can search on free websites like WellRx and GoodRx. They provide consumers cards or coupons for the prices they show, which include special discounts.
Using a tool like WellRx, you can come in with the price and the information and hand it to the pharmacist.
And here's a really simple thing you can do. Just ask. Ask your pharmacist what the cash price is. The pharmacist can't volunteer the information, but if you ask, the pharmacist is allowed to answer. Now, this is part of our continuing effort to create transparency in healthcare and save you money through Philly health costs. It's our partnership with the Philadelphia Inquirer. We've put a link to an Inquirer story about the gag rule on 6abc.com.